So I was privileged to ask to talk about this topic at the North American Conference on Lung Cancer in Chicago. And the point of this talk was really to hone in on what is the duration of immunotherapy, and are there opportunities for potentially looking at shorter durations of therapy. This has really been an ongoing question that we have in our clinics when we see patients. How long should they be on immunotherapy? How many of these patients could be cured and could potentially stop at earlier timeframes? How many need ongoing treatment, and what is the right duration? I think a lot of us have felt that 2 years has become the standard, not necessarily driven from science, but from how things were done in the clinical trials, which was a bit arbitrary. So we talked about that at length in this talk. I think some of the early development of checkpoint inhibitor immunotherapy trials actually allowed continuation until progression of disease or intolerability of these drugs. But most of our trials that have been done in the frontline setting for stage 4 non-small cell lung cancer have put that limit of 2 years on them. I think that you can look at this two ways. One is that there are a group of patients who get early benefits and potentially may not need that full 2 years of therapy. And there are others who take a little bit longer or maybe have somewhat stable disease that doesn't have a complete response, who may benefit from longer durations. There certainly was a trial called the CheckMate 153. Wasn't originally designed this way, but it ended up randomizing patients to 1 year or longer. And the data from that trial suggested that a PFS benefit and an overall survival benefit was seen in those that had continuous therapy beyond 1 year. So we tend to think that longer is better. But I think as we approach that 2-year mark, we do see that after 2 years, patients continue to have progression of disease, and ultimately, by the time they get to 5 years, not as many of these patients are still living. And we see about a 25 to 30% drop off, just between year 2 and 3. The question is, does continuing immunotherapy beyond 2 years change that fact, or is that just the biology of the disease that they were going to progress regardless of how long they got the immunotherapy? So to me, it's really still an unanswered question, and one that I discuss with all of my patients. I think there's a lot of factors that go into who should stop earlier, who should go to 2 years, who should maybe go beyond 2 years. And I don't think there's any clear right answer across the board.